So as we're talking about, focusing on peers and wanting them to talk to friends, we're going to take that and move it to the side because we're now realizing it's way more than not speaking. It's about forming those connections and the comfort areas of interest, confidence boosting, lowering anxiety, and implementing the appropriate strategies and interventions to help the kids make that progress through areas of interest and not focusing on speaking, but maybe it's hand over takeover in the beginning. Maybe it's, sounds to words. Maybe it's using a verbal intermediary, whatever that strategy would be. And I just want to be clear with listeners. It's so hard for us to tell you what strategy to use. There's a listener or two that might say, "Well, give me the strategies, give them to me." It's based on your child. It's based on your teen. It's based on you. If you're an older individual, it's how do we put these strategies together in a recipe format for you? So it's really hard for us to say, do this strategy. I will tell you that when we talk about comfort, connection, confidence boosting, that's universal. It
Mhm.
lowers anxiety, plain and simple. Don't wait, facilitate. It's universal, but what you're facilitating, how you're doing it, when you're doing it, with who you're doing it, what strategies you're using, when, where, and how is really the unique piece. And that's why for us, SCAP being a whole person approach, a very CBT based approach, being very behavioral, obviously, exposure based, etc. It's so much of meeting that child where they're at, knowing that unique individual. What are their whys that are contributing? Because no one's just born to be selectively mute. There's a reason why they're not communicating. And what are their baseline stages? That's why when we do the selective mutism eval, or the selective mutism interview, we are conceptualizing the case. We are telling you this is how your child, the teen, the adult presents. This is it. This is your case. These are the contributing factors. These are your baseline stages to start at. Here are best strategies that we use during that selective mutism evaluation, for example, that helped with progression. These are the areas of focus and treatment. We're going to help you do 1, 2, 3, 4, and 5, 6, 7, whatever it is, and this is the direction of treatment, and these are our recommendations. That's what it is. And I keep bringing it up because whether you work with us or not, the selective mutism eval conceptualizes your child's presentation,
Mhm.
your teen's presentation, the adult's presentation. It conceptualizes it, and that's where we pick which strategies to use and when. Everyone should have a small group. Everyone should have a buddy process. Everyone should, understand that comfort precedes communication. Progress doesn't happen in a group. But it's when and how and where and with who you use these strategies and how you manipulate them to be able to help with progression, to build that, more confident social communicator. That's why it's so hard for us to say, do this strategy and when. We can talk about the various strategies, but how it works for your individual with SM is really what makes this work. And I call it a unique recipe. It's a whole person approach. It's a recipe that your child needs, your teen, the adult struggling needs to help them make that progress. And I'm saying this with such passion because so often it's like, give me the strategies. Tell me what the 504 is. Tell me what the... No, it doesn't work that way. It's about knowing who your child, teen, adult is. It's about understanding that. And so we talk about the transition time, with this podcast is airing towards the end of a school year. It's April. It's April. And it's now winding down. And for many individuals with selective mutism, the end of the year is harder than the beginning of the year. I would say universally, the beginning of a school year is when anxiety is highest for everyone. You're starting in a new grade, a new school year. You're going to have new kids in your class, new teachers, new professors. Everything's new. Your classrooms are different. You might be transitioning into a new school year. So the beginning, or transitioning schools, not just a new school year. Of course, you're transitioning to a new school year as the school year ends, but it's going to be maybe a new building, kindergarten to first, or preschool to kindergarten, middle school to high school to college, workforce. These transitions are huge. And we're going to go into an episode and we're going to talk about an episode coming up on transitions. It's going to be a meat and potatoes, heavy transitions. But to tell listeners right now that it's a very key time to start thinking about the next school year. You don't want to wait till the summer. You don't want to wait till the start of the school year. You need to think about, does my 504 or IEP for kids under 12, grade 12, need to be adapted? Does testing need to be in place? Are you implementing strategies and your child is stuck? Is learning affected? Are they having difficulty starting, completing tasks? Is it, what else could be going on? Do you need testing? This is when we do it. This is when we start thinking about educating for the new school year, to think about peers, to think about pairing and grouping with as many peers as possible that your child is having outside get-togethers with, that have similar interests to. Can we think about that from a school perspective to make sure they have buddies for the new school year? So it is not too early to think about walking the halls of the new building, being upbeat and positive. I have to reinforce that because parents get nervous, they get scared. And I'm going to tell you that how you handle this is how that's projected onto your child. So if it's exciting and it's new and it's going to be great, versus, oh my God, I'm worried, I'm nervous, I'm scared. So that transition part is really, really important. And how we work that transition obviously is unique for your child. But I will say globally, thinking about next year and how we're going to educate that new school year staff, how we're going to help with that new building if we're moving into, how are we going to work over the summer with peers, with building those connections that ideally could be in their class, 504s, IEPs. Anything else you want to add? Because I know I just rambled on, but it's really an important topic that I want to spend more time with in another episode.
Yeah, no, I definitely think we'll have more, thorough conversation when we have a longer time to go through everything, but everything you just said I think is really important. And I also would say like definitely rely on your treatment provider, right? Whether that's us or whether you're working with someone more locally, we can definitely help you navigate a lot of these changes. Literally right before this podcast, I was working with a family who has a 3-year-old and already knows that they're transitioning. And so we worked through that today, and it's only April. So having those conversations prior, kind of trying to prepare your child, trying to prepare yourselves, thinking about what, like you mentioned, like what does this summer look like? How can I get them prepared? What's enough preparation versus what's too little preparation? Like there's so many things that are important to note. But again, I think the biggest factor is definitely having these open communications, with us, with your provider to really help you navigate because, you're not alone. And I think that there's many families that feel similar to you. If you're a family that is, hoping to attend, like a future communicamp or you've been to a communicamp, you know that many times we talk about school during our communicamp weekend, and specifically over the summer we talk about school, but a lot of that is that transition period because we know that it's the summer break. And so sometimes those are frequent questions that are asked. So there's definitely ways, whether it's a group setting, whether it's, individually with us. But yeah, it's definitely a very important topic. So we hope that this was helpful today. And we're excited to, yeah, release the next episode of Transitions in the future.
Yeah, no, this is great. And I do just want to say something else about Communicamp. If your child does struggle in school with communication, social engagement, or even academics in terms of like figuring things out, is there something else going on? One of the things that's so wonderful about Communicamp is because the kids are in a room with trained clinicians as quote unquote counselors, we're able to see a lot. We're able to really see how your child navigates. Are we seeing things that are flags to maybe think about other challenges that might be going on? Learning, we even see other social communication difficulties that may need additional testing, but also we can really see what works for them. And what's beautiful is that kids make huge progress at Communicamp and they see themselves in a school environment, an actual school making progress. And that feeds so well into school because they were in a school and they made progress. So with that, and then that, literally 15 plus hours working with parents, coaching them, role plays, we really teach the skills to the parents and we really do help them see this in just a different light. One of the questions I ask at the very beginning of most communicamps is, how do you see selective mutism? What does it mean to you? And it's amazing how people have different definitions, but it's amazing how they view this so differently as the weekend goes on and what they learn about their child, because it's really about working through that. so that you have a really strong understanding and conceptualization for your child and what their needs are, so that you can really fuel that progress from day one, day two, and ongoing. So we do encourage, and we want to tell families, if you are considering Communicamp, please know if finances are a challenge, we are so passionate about helping families. We offer financial assistance based on need. We do have grants often given by other families. We give our own grants to help families attend. So we don't want costs to get in the way. We want to help you as much as possible to attend.